This is my honors enhancement presentation on spinal muscular atrophy. The topics that we will be talking about today are: what is SMA, causes of SMA, the types of SMA, the diagnosis, treatment, prevention, and current area of research. What is SMA? It is a genetic disorder that causes muscle weakness, atrophy, which is when the muscles get smaller, and loss of movement. It affects the ability to crawl, walk, sit up, and control head movement. It damages muscles for breathing and swallowing. It is the second most common severe hereditary disease in infancy and childhood. It is twice as common in whites and Asians than Africans and Hispanics. It follows an autosomal recessive pattern, meaning both biological parents pass on mutations in the SMN1 gene. In most cases, the biological parents of someone with an autosomal recessive condition each carry one copy of the mutated gene. But the carriers typically don't have symptoms of the condition. In the general population, mutations of the SMN1 gene are common. Among white people, 1 in 50 may be a carrier, and it can strike at any age. Later the onset, the better the prognosis. 1 in every 6,000 babies is born with SMA. The causes of SMA: it is caused by a mutation of the survival motor neuron 1 gene, SMN1, on the 5th chromosome. When this gene is mutated, it can't make enough protein for the motor neurons to work properly. The motor neurons break down and can't send signals to the muscles. One copy of the SMN1 gene is received from each parent. In a child with SMA, both genes will be mutated. If a child gets one healthy gene from a parent and one mutated gene from the other parent, they probably won't show any signs of SMA, but they could pass the mutated gene to their children. There are less common types of SMA that are caused by changes in other genes. The number of copies that you have of the SMN2 gene alters the severity of the condition. SMN2 gene also produces a small amount of SMN protein. A person may have up to 8 copies of an SMN2 gene. Having multiple copies of an SMN2 gene typically leads to a less severe symptom of SMA, because the extra gene makes up for the missing SMN1 protein. These are the 4 types of spinal muscular atrophy, which I will now go into more detail. Type 0 is rare, but it's severe. It affects the fetus before birth, and it causes respiratory failure. Death happens either at birth or within the first month of life. Symptoms of type 0 include decreased fetal movements, stiff or frozen joints, hypotonia, which is decreased muscle tone, severe muscle weakness, and severe breathing issues. Type 1 is the most severe. It is usually diagnosed within the first 6 months of birth. It makes up a majority of the SMA cases at 60%. These usually die before their 2nd birthday without the proper breathing support. Symptoms include limited head control, hypotonia, areflexia, which is the lack of reflexes, the inability to sit without support, abnormal breathing, the bell-shaped chest, which is shown in the picture below, difficulty swallowing, and facial muscle weakness. Type 2 is usually diagnosed within the first 6 to 18 months of life. Those with type 2 may be able to sit but cannot walk. 70% with type 2 live to age 25, and some even live to 30. Respiratory issues cause a shortening of life. Symptoms of type 2 include hypotonia, areflexia, worsening muscle weakness, which affects the legs more than the arms and the chest, which could lead to restrictive lung disease, scoliosis, jerky movements in the hand, mandible, which is the stiffening of a jaw joint due to bone fusion, and joint contractures. Type 3 is usually diagnosed after 18 months of life. It is the mildest form to affect children. Those with type 3 don't tend to develop breathing issues, and it doesn't affect life expectancy. Symptoms include the lower limb muscle weakness, primarily in the legs. Type 4 appears after 21. It is rare. Most remain mobile. Muscle weakness progresses slowly. These have a normal life expectancy, and the symptoms worsen over time. Symptoms include the mild leg weakness, tremors, and some breathing issues. This slide shows the overall effects of spinal muscular atrophy. You have your muscle weakness in your hips and thighs, difficulty breathing, lack of muscle tone, diminished reflex, spinal curvature, which is scoliosis, difficulty swallowing, and your muscle weakness in your back and shoulders. Diagnosis can be through genetic testing, creatine kinase blood test, electromyogram or nerve conduction study, muscle biopsy, amniocentesis, chronic villus sampling, and SMA is also looked for in newborn screenings in all 50 states. So the management and treatment of SMA is physical therapy, occupational therapy, speech therapy, assistive devices such as wheelchairs and braces, feeding tube, ventilation, Spinraza, Evrysdi, Zolgensma, and prevention. It is not preventable. You can take genetic testing to see what your odds of having a child with SMA are. Pre-implantation genetic diagnosis is when you identify embryos that don't have the mutated gene, and then you can take those embryos through IVF and get your child that does not have the SMA gene. Current area of research is primarily done right now through the Children's Hospital of Philadelphia, where research studies and clinical trials seek to find the next breakthrough in the treatment of SMA. Research shows that kids with spinal muscular atrophy do the best with a team approach to their care. Ongoing research shows promising results in improving overall function in people who have the condition. Gene therapy is also a big area of research. Research is focusing on the increased production of the SMN protein missing in the chromosome 5 related forms of SMA. In 2016, Spinraza was approved by the FDA, and it is designed to treat the underlying defect in SMA. In 2019, the FDA approved Zolgensma, the first gene replacement therapy for a neuromuscular disease. In 2020, FDA approved Evrysdi, an oral medication to increase levels of the SMN protein. In 2022, the FDA approved a label extension for Evrysdi. Here are my references, and thanks for listening.